Okay, everybody, thank you for logging in. Chris Thornley, Chairman, Board of Health. This will be our regular monthly meeting, October 14th. Present here is Chris Davis, Nancy Barral, Michael Hurley, and Eden Lippis, all dialed in or online. Obviously, if there's anybody that dials in, we can certainly add them to the meeting at that point in time. At this point, we will, there is no other people that have dialed in, so there is no other public participation at this time. So we will move right to the next step, which is approval of the meeting minutes from September the 9th.
I make a motion. Davis makes a motion to accept the minutes as written.
Excellent.
Hold on a second. We have to make that change. Are we going to make a motion to change?
Yeah, we're going to motion to change the minutes to just put the following in, that it was held virtually.
Yep. Yeah, virtually online. Now, one other question, Chris. What time did the meeting start?
This one started at, we're going to call it 6:09.
Okay.
Okay, so we're going to amend the minutes as previously spoken, and motion to approve.
I second.
Okay, and a vote of Chris Davis.
Aye.
Nancy.
Aye.
Okay, and Michael. All right,
Well, I second.
Oh, that's true. You seconded. I apologize. All right, so it carried unanimously.
And who first?
I'm sorry?
Who made the first motion?
Well, I motioned it first to amend and then to approve.
So Mike approved?
Mike approved as amended as well. He actually seconded the motion.
Hold on a second. I'm confused. I'm trying to write this here. A motion was made by Thornley, seconded by Mike, to approve the minutes as amended?
Yes.
Okay.
It just not as professional.
Okay.
Okay. So we will move right on to letter D, and I'll turn the meeting over at this point in time to Nancy to start running down some of the items that we need to discuss.
Let's see. So that's done. Environmental Health Activity Services Report. Everybody, this one. Essentially what you see on this report in September, we've had a lot more septic inspections, and we did some food inspections, but the more inspections for septic makes less time to do food service inspections. So we're juggling a lot here.
Really good.
That's all that I can really point to on the Environmental Health Services Report. The only other thought that I can share is that we still have our part-time employee that is inspecting some of our salons and a few of our food service establishments. Have maybe, how much left in the account? Yeah, we got about $600 left for him to conduct inspections for this fiscal year that we're in.
Okay.
Any other questions?
No, nothing really jumped out at me as I kind of glanced over these at this point. Obviously, you know, we know everything is going to be juggled as best as possible at this point, you know, given the state of affairs.
Yeah, that's what it comes down to. Okay. If there are no other thoughts, I'll move on to the revenue report.
Okay, just so that you know, this is Mary Porter. I jumped in late.
All right. Thank you for joining us, Mary.
Hi, Mary.
Hello.
So, Mary, what we are on, we've just finished with the environmental health services report. Do you have any
Okay.
thoughts on that?
No, all good.
Now, I wound up forwarding the complaint list was from last meeting's request.
Correct.
Any other comments or thoughts on that?
No, it was quite varied, and that was what I wondered. And things like dropping keys in meatballs and not pulling the food, I thought that was pretty interesting. So I don't know who else looked over that list, but yeah, that was pretty interesting. That's why I asked what kind of complaints there were,
Yeah. And we write them up as we get them. You know what I'm saying?
Right. Right. And what it doesn't say on there, and I'm not asking for this, I am not requesting more detail, but if it's somebody that lives in the town-owned senior housing versus if it's somebody who rents and they're complaining about their landlord, is probably two different things of how much town responsibility there is, but all of it's good. It's all good.
Yeah.
So anyway, okay. Thank you, though. Thank you for supplying that.
One other thing that I'd like to at least share is that we've received a number of complaints concerning people not wearing masks. And just to let you know, we take in the complaint, we enter it into our database as a complaint, but it's actually forwarded on to a different department to follow up. And if
a different department in town or in the state?
In town, here in town.
Okay.
Yeah, and it's because there'd be no way for us to do all of that work. It would be more than the bandwidth that we have. William Holsworth, he's the person in town who, and I'm not sure, he works with economic development of some sort. Yeah, he's the person that helps us by going out and doing these inspections when there's a problem. And a part of the inspection is really an educational piece on, are you letting people in your restaurant that are not wearing a mask? Why aren't your food service workers wearing a mask? Do they have doctor's notes? All those kinds of questions he asks, and he lets them know that the next step is for the health department to come out and possibly PD, and we could issue fines. So we haven't gotten to that stage yet. A lot of it is just a lot of that outreach and education. But I want you to know that increasingly we're getting these types of complaints. Okay, so
you have to wonder too on that. Is it that there are more complaints because it's happening more, or are there more complaints because people are out more now and more people are out, so they're seeing more, which might be it also. Right,
exactly. Today at the State Department of Public Health's Directors of Health meeting, there are 20 towns in Connecticut that have gone over 9% positive COVID cases. And the state is trying to figure out, what are we going to do? This is over the top. And so what the plan is actually have members of those towns come in for a training on how you address code enforcement for businesses that are not following the, open CT Connecticut rules, So luckily, we're not there. So, okay. So that's the environmental health report. Let's move on.
Nancy, I have a question to clarify what you just said. You said over 9% positive. Do you mean over 9% positivity? Do you mean 9% of their population is positive, or do you mean 9% of the tests are positive?
It's got to be the test. They wouldn't know otherwise.
Positivity, not positive.
It would be the test.
I agree.
Yeah, so that's the positivity.
That's right. That's exactly
right. Okay.
Yeah.
Thank you.
All right. So then I'm looking here at the revenue report. As you can see, we have not quite twice what we received in funds in August. And really that represents a lot of work that is to be done this month. People are paying for last month, and a lot of that work winds up getting done this month. So, any other questions on that? I don't see anything that jumps out.
No.
Nope.
I'm good.
All right, so the grants, we're collecting them. We have up to 6 now. And so I'm just going to run down quickly where we are in each of these. And if you have any specific questions regarding the grants, please let me know. The first one is the Preventive Health and Health Services Block Grant. I'd mentioned last meeting that this grant, we're kind of dead in the water because this grant requires us to do screenings. And it's difficult to do blood pressure screenings without meeting somebody in person. And if there's a training, and I had called the state health department and thought that maybe we could develop some sort of a training on Zoom where we could do, like online training. But the problem is this is connected to a federal grant that the state gets. Therefore, they're unable to change the requirements of the grant. So they don't know what they're going to do. And so we're kind of dead in the water. I don't know what's going to happen with that grant.
As far as the amount of screenings go, is it something that we have to show on a monthly basis or a quarterly basis, or is it just like a total aggregate for the whole year?
It's an aggregate for the whole year. And but not just for the screenings, but once the screenings are done, then we actually have to do a training. And we have, I think, 6 or 7 people that come from Griffin Hospital, actually, and they actually provide training on medications, heart health. There's a whole series, but we need to capture a large enough group so that when we actually schedule the trainings, there'll be enough people. 10, I think it is what we're looking for. We hope for that will take this series of trainings. That's the requirement of the grant. We wound up calling all those that had planned to go to our last training, and they're at the point. All of these actually, they're just not interested in taking the training now, especially with everything happening. They don't want to leave their homes. They're just not interested.
Mm-hmm.
So I don't know what's going to happen. And I don't know if the state knows what they're going to do. They're trying to figure it out. So the second, yeah.
We have, this is good. This particular block grant is good through, September of 22. So,
right.
As long as, we could shelve it for kind of the time being, at least the in-person stuff, which is probably most of what you have to do.
Right.
And hope that, as things progress, things will get better, vaccines, what have you, heard, all the different things that are obviously going into, the stopping the spread of COVID. So hopefully those things will start to occur, and then we can kind of pick up and continue on with it at that point. But, it is what it is at this point. And I would say, there's not a whole lot we can really do about it, like you said.
Right. I know that I don't have in front of me how much we've received in funding for the first year, but we've actually received full funding for the first year, even though we couldn't give the classes. They were scheduled in March, and we just, everything happened and the floor fell out and we couldn't provide the training. We had the people, but we couldn't give the training.
Mm-hmm.
So, but the state paid us the full amount. All right, now the Emergency Preparedness Grant 2019-2020, it's closed at this point. We've got our fourth quarter payment of $1,997 and change. And now we're into the new season that actually started July 2020, which is grant status number 3. We've submitted the paperwork. We're waiting for the documents to be returned to us in the form of a contract, which will then have to go to the town council for approval. So that's in process. We have a Health Enhancement Community Initiative grant. This was a promoting breastfeeding, and it was an initiative that we were going to spend monies over at our library to set up a private area so that mothers could nurse their child. And we just received the $5,000 in the mail, essentially.
That's good. It'll
Yep.
be ready when we open up again.
Yep. So, I mean, and so I'm trying to figure out when they're going to make the installation over there, but part of the grant was to buy the partitions, to buy the chair, maybe a table, find the place in the library, install them. The next part was we were supposed to do some outreach, health outreach for food and things like this at workplaces. But again, that part of the grant fell through because of the COVID environment. But what happened is we just started focusing on other things like preparing a procedure or a policy for breastfeeding at the library, and we were able to substitute one for the other. And hopefully next year we'll be able to do the outreach like we need to as part of the grant. But in any case, Stratford, they are hosting the grant through the state of Connecticut, and we've received our $5,000 for this year. So it's all good news. Let's see. The next grant is the ELC grant, which is that grant has been approved by the town council, and it has been submitted to the Department of Public Health. And they changed. There were a couple things that they sent it back that they wanted me to change the hours because rather than calculating on a year, they wanted it calculated on 32 weeks. It was just an interval change. And so it's taken us a little longer to get that squared around. But so that money will be forthcoming. With those funds, we plan on hiring a public health nurse to help us do contact tracing, to do outreach at the Board of Education, because as cases or contacts occur there needs to be somebody that will coordinate our contact tracing with what they're doing over there and giving them advice. That's a big part of the grant. Also, outreach to our food service and salon establishments just to provide education on wearing masks and things like that, handing out information materials. So that's the nature of that grant. Then on the next page we have of the agenda is a COVID-19 crisis grant. We just received $1,946, which was submission number 6. And a submission is every month, to be honest. And then I've just submitted submission number 7 for $1,199. And so that money, they're pretty quick with the turnaround. Those funds are used for our public health nurse to do contact tracing. And also to purchase a computer setup for her to do the contact tracing at home, because a lot of the callbacks and such happen when she's home rather than sitting in the office. The remaining funds available on that grant is like around close to $10,000. So there's a significant amount of money in there. So that takes care of the grants. Any questions?
Nope.
Not for me.
The only question that I would have is, what do we have any kind of timeline on the on either one of the last 2 grants as far as when dollars, the larger sums of money can start coming in, so we can actually go and hire this public health nurse,
right,
to
what
do
we're
this
doing,
type of work rather than just our part-timer.
right.
Obviously she's not doing a lot of other things like the blood pressure screening and so forth, so utilizing her to do some of that is fine. But with the dollars that look like they're coming in, we're looking at a potentially temporary close to a full-time type position,
Right.
between the two, because they're kind of intertwined.
That's right.
But it's two different budget sources.
That's exactly
So,
right.
yeah, they have to both sort of stay in their own column.
They do. They do. They can't overlap. Now, so the larger grant that is the ELC grant, I hope within a month we'll start getting payments. We're in the process now of looking at applications for, we've advertised the nursing position and we're currently looking at applications.
Okay.
And hopefully next week, Human Resources will start sending out invitations. I'm not really certain how that works, but I'm supposed to meet with Mike Brown next week and work on that part.
Okie dokie.
And also the some of the funding that is in the of that $10,000 remaining in the COVID-19 grant, we're going to be buying a computer for a laptop computer and accoutrements that the new public health nurse will be able to use for contact tracing. Because what happens is when you're interviewing somebody, if they're not home, you call and leave a message. Well, they're going to call you back. It might be after work. It might be at different times. And there's no way to know. So you really have to have your workstation with you.
Absolutely. 100% agreed.
That's all there is to it. And that, that'll also include a cell phone, a hotspot on that cell phone, so you can always talk to your computer wherever you are, those kinds of things.
Okie doke.
All righty. Anything else?
Nope.
That's about it.
Okay, the coronavirus and emergency planning. Just wanted you to know that the state health department is currently working regionally, trying to figure out how we're going to mass dispense COVID-19 vaccine. There is plans being put in place to distribute vaccine. And it's still very much up in the air and in planning stages. I can't give you too much information on that. If you have any questions that I might know and I don't have an answer to that, I don't know at the moment. Any thoughts?
Not really.
No.
The only other thing I can add is that in Region 1, some of the planners are thinking of having like a strike team, because there's a lot of little towns to have, when the vaccine is sent out, let's say we get 20 doses here in town. Well, it's going to be hard to have a mass vaccination clinic with 20 doses. So they're trying to think alternatively, what is a better way to do this? Have a strike team and go to individual towns. And of course, rather than having a mass vaccination clinic or, regional where you have 2 or 3 clinics, they're trying to work on different models on how best to address this issue.
So can I ask, has anybody been able to get any feedback from the people in town who normally get their flu vaccine from the town? So for instance, the town nurse, right, the public health nurse in town normally did last year's flu clinic, correct?
Not exactly. She arranges it, but rather, because we don't have all these providers agreements, it's a lot of extra work to do that and then do the billing and everything. What we elected to do was to just call up our pharmacists, and we rotate every year, and we ask them to provide the vaccine, and they bring their vaccine to a clinic, and they provide the vaccine for our community.
So this is just me thinking from what I've seen. From what I've seen of what people are doing with coming to the hospital as patients, from what I've seen when I'm at the pharmacy myself and see people coming in, because I don't think there's been a time yet that I've been at a pharmacy and not seen someone there getting a vaccine.
Yeah.
I think a lot of people are going into the pharmacies and getting a vaccine.
They are. Yep.
And I think that people who are going to their doctor's offices, a lot of people didn't get to see their doctor for a 4-month period or so that maybe they normally would have. And especially a lot of our older population don't go for an annual physical. They go every 3 or 6 months. And telemedicine was not really their gig. So if they did get to see their doctor during that 4-month period, they didn't necessarily get the satisfaction out of it that they might have by going to the office. And I think a lot of them are catching up now, and they're in their doctor's offices the last month or so, or, the past couple of months and the coming months. And I think they're probably getting their vaccines from their doctors. Now, I can't prove that. I have nothing to say that. But if we know who was coming to our clinic last year and getting their vaccines at our clinic, we could reach out to them and just say, do you have a way to get your vaccine this year? And I realize that sounds like, I know that's probably a lot of work, but how many people actually got their flu vaccines at the town last year?
Well, it's different. That there's town hall or town employees. This year, as a matter of fact, the next item on the agenda are 2 flu clinics we've had already. We advertise them on Facebook. We did outreach like that. We had 46 people, and the pharmacist can take care of 46 people. That wasn't a problem. We had it in the council chambers, and then we had a drive-through clinic, and we had 35 people sign up. And so the drive-through, we actually kind of practiced our scheduler with our scheduler that's on the town website. People could sign up. We had scheduled that a person could sign up every 5 minutes and to fill up that schedule. But if you think about that, that is not the best way to have a flu clinic. It might be the only way to have it in the event of COVID, but 5 minutes it takes to process one person, and it takes that long, But
that's not. It's 5 minutes per person, but that should be an overlapping 5 minutes, not a consecutive 5 minutes, because the car that's at the pull-up point is getting the clipboard to fill out the paper, and maybe their 5 minutes starts there and ends with when they get the shot, but the car that was before them is already at the next point, so it's not waiting 5 minutes per.
We measure throughput. How long does it take from somebody that when they enter to get to leave?
Right, but you see what I'm saying is, if there are 2 people in the car, they're both filling out the paper at the same time. So it's really not as inefficient as it seems by saying 5 minutes.
True, but what I'm saying is a regular walk-in clinic, you can really, somebody to get their vaccine, if their paperwork is filled out, that can be a bottleneck. It depends on how you have your clinic set up. And if you have enough people providing vaccine, they could be like a minute. It doesn't take that long.
Right.
But anyway, the long and the short of it is that we were, it took about 5 minutes to do the drive-through. Trumbull, I had volunteered. They had a drive-through on this past Monday. Their plan was to have a drive-through, and I had volunteered. But because of the weather, they canceled it, unfortunately. My thought was I should have had it anyways. So what is adverse weather? It's a good way to test your adverse weather exercise. So anyway, that's the way it's going regionally, statewide, is to do these drive-throughs. Yep. Any other thoughts on that?
No, I think that's great.
Okay.
No,
I'm sorry.
Well, I was just going to say, while, sometimes paperwork can take a little longer, a little shorter, I think the general idea of what you guys have set seems fine to me. Could you do a little bit more? Maybe. Could it take even longer and people are going to get upset by waiting longer? Possibly that too. So I think you just stay with what you got.
And if they're in their car it's a bit trickier to give somebody vaccine if they've got to take their coat off, their seat belt. It can be more difficult. But we were able to have a throughput.
But it's easier for them than them having to get out.
Well, that's true.
You know?
That's true.
They don't have to be as mobile.
That's true. And it's definitely safer. It's definitely safer.
Yeah, you don't have to worry about them falling down.
Or actually being safe from COVID, because you've naturally got your 6 foot separating distance, you know?
Well, the staying in the car thing, I definitely, I kind of like that. I mean, for real, and when the appointment is scheduled, you should tell them to be prepared for, this is the way it's going to go. Make sure you have your coat off, or are able to pull coat down, past your shoulder, or whatever, shirt you may have on, be able to pull up past your shoulder to be able to, receive your inoculation. And, I think that would be a far more better way of doing it. Because if somebody does have to sit for a little bit longer to wait, well, at that point, they're in their car, they're listening to some music, they're getting paperwork straight. They're, it's an easier wait than going and sitting someplace, just getting more and more annoyed.
Right. We thought that, we had our event over at the senior center. We ran out of volunteer parking almost by one space. So that's the one thing we could have done better. But the exercise went very well. I would say we had good feedback, and I think the next time around we would try it at Chalk Hill. We'd have more space there.
Well, and there's a beautiful loop, there's a nice traffic flow there.
Right. Because here, you could wind up, if everybody came at once, you'd have people out on the road, and that would be a huge issue for the police department. So, but anyway, this was our first, I don't even want to call it a drill or an exercise, because it was a real world event. You know what I mean?
This might sound like a weird suggestion, but is there a plan for another flu vaccine clinic at this time?
No.
Because if there was any thought of doing it on Election Day in the parking lot at Chalk Hill, because a third of the town votes people who are going to vote in person, a third of the people in town who do vote at Fawn Hollow, it wouldn't be a bad idea.
Yeah.
But
yeah, we did. That was a good thought. We didn't plan on that.
And quite frankly, people have other resources. Every pharmacy in town has flu vaccine. Yep. Doctors' offices have flu vaccine in. So it's not short this year by any means, and they have a way to get it.
And the state health department's already making arrangements, and I think that the government, I don't know, CDC or NIH, they've already have contracts going with major pharmacy companies like Rite Aid to provide and to distribute COVID-19 vaccine. Yeah. And so what's interesting with that vaccine...
The vaccine we don't have yet?
Yes. They're all... This is why the planning is they're working on it. The vaccine, some of them have to be... One type of vaccine has to be stored at like 80 degrees below freezing. Or, it's like they don't even... No health department has a way to do that. And these vaccines are 2-dose vaccines. So the person that receives the first dose needs to know to come back in 20 days. And then you have to have the clinic in 20 days. It's going to be interesting, It's going to be interesting. All right. So is everybody ready for new business? Yay.
Uh-huh.
Oh yeah,
my favorite part.
Barbara's reminding me, the MOU. That is to be signed by Dr. O'Reilly. It's waiting here for his signature, basically. That was approved by the town council last month. Okay.
Do I need to push him a little bit to get it done?
Yeah, you can nag them. Tell them it's it's the first selectman's office.
Okay.
And, you know, he is now the chair of planning and zoning, so he comes and goes from town hall a little bit with that too.
Okay. All right. Now the next one is the annual report discussion. So before I kind of, wanted to get going on the annual report, I would like to talk about the format and the items that you would like in or out, because it's a lot of work to put it together. And so if I have guidelines at the start, it'll make it a lot easier for me to put the report together. So I provided, or actually Barb sent you the Town of Trumbull and Stratford's annual report for you to take a look at, and ours. And so I'm just wondering how we would proceed next, I guess. Chris, what you thought?
Well, honestly, I did not have a chance to kind of really go through it.
Okay.
If anybody has any suggestions, we can certainly take some suggestions if other people have had the opportunity to go through the material and kind of read it over, mull it over kind of thing. That's no problem. If nobody has really gotten to read it too much, or there are no other suggestions per se at this point, I would say, let's just go ahead and table that conversation, for the next meeting.
Okay.
Did anybody have an opportunity to read it and or have any suggestions at this point in time, or should we just move on to put that into the next meeting?
I did look them over, but I don't think that there's anything big that I need to say about it. That was
Okay.
Mary. Sorry, that was Mary.
No problem, Chris.
I help to interrupt, but
Good.
my husband asked, how are the health inspections in general going? You can make that the last topic, or you can do it very quickly. He's just sitting here, so he's asking questions.
How's the health inspection? And what was that again? I'm sorry, Enid, I didn't hear that.
He asked, my husband's sitting here, so he asked, how are the health inspections in general going in Monroe?
Well, the health, in other words, does he mean food inspections or salons, or what? Is there anything?
I think he's just asking a general question. Pretty much people following the rules. I know what you said about the mask. The mask I'll say.
Yeah, it's a mixed bag. It's a mixed bag. I would like to get out there and do more regulated inspections, but we just don't have the staffing, and we got to be careful when we go out there and do the inspections in the world. So numbers are less. There are, and the complaints are also connected to inspections, and some of those complaints that we receive are, there's whole issues regarding mask wearing, and so that's a mixed bag too.
Yeah.
Some restaurants, they're fully compliant. Others get complaints, and and we've got to go out there and do our educational piece. It's tricky.
Yeah, because we both heard about the mask. So go back to your stuff. He just wanted me to ask, so I thought I would ask.
Oh,
I'm
no,
listening.
that's fine. Anything, anything. You see it here, just let me know and I'll clarify it. Just a lot of stuff here.
Okay.
All right. So what I'm wondering is if during the next meeting, if you guys have a chance, because I know we had looked at the annual report 2019, and there were some items that you thought that maybe we did not need in the report. And they're like, one of the things that I would advocate to have in this year's report, or actually last year's report, is under community health services. I thought we could have a large section on COVID-19 and have a few graphs. We have some graphs that I can send you that you can take a look at, which it compares regionally, regionally where we stand with the state. These graphs really kind of point out the differences of the towns that are around us, how the rates compare. So they're quite interesting, and maybe one or two of those graphs I can include in this report.
I think that's something that people might be interested in.
Yeah,
I think that those who want to know, how did we stand with numbers in Monroe for COVID probably do have a good idea of how we stood for numbers.
sure.
I think something that I was interested in and others might be interested in is maybe if you were able to collaborate with the Board of Ed to give a report to the general public, like parents might have a good idea of what did the schools do to prep to go back for the school year? What are they doing in the classrooms? What did they do to put a barrier between the teachers and students? I think that those of us who, for instance, I don't have kids in school anymore. I talked to a neighbor and she told me what she knew. But I think that a little report of that too, like we know what the rules are that get posted out for all of us. But like
Yeah.
what, as the town services, for instance, at town, we all know that you can't go into town hall unless you make an appointment for what you need, right? You can't go in. They come out to you or whatever.
No, you can come in now.
Well, now you can, but when you tried to before that, you couldn't. But what we don't know is, so what's done, even an update like that. Updates of not so much historically, although the 2020 report is going to be a little bit historical of the curve of what happened this year with this.
Yeah.
But letting us know. So when it was time for the school year to go back, here's what happened. Here's what's happening now with town services being offered, and here's what's happening with the library. Here's what our response to COVID is so that people know.
Now, so what I'm thinking is that because this is an annual report, these are activities that go through to the end of June this past June. So some of those things
so it's July to June.
Yeah. Now, what I could do.
Oh, so everything was closed.
Yeah. Well, I can mention some of the things that we've started doing and message from the director. I'm certain I could put some thoughts in there, or yeah, I mean, some of that stuff we can put in here. That's a good idea.
But if it was July to June and we're sitting in October, shouldn't it be done?
Pardon?
If it ended in June and we're sitting here now in October, I don't think we should be talking about it next month.
Yeah, but this is the annual report for the fiscal year, for the past fiscal year. Right.
But we can wrap it up instead of putting it forward in our meetings, I think.
So, what do you, Chris? What do you think?
I haven't had a chance to really look at it. I mean, obviously, yes, I want to have some statistics and so forth about COVID, what some of the response has been. You can certainly put some of the historical data in as far as what days things were shut down and, how well things are going since they've been open, what level we're at, that kind of thing. That would certainly be no problem. As far as the rest of the formatting and some of the other things that they have in their reports, again, I can't comment because I really haven't read it.
Right. Okay. So, my thought is what we're doing now is we're going through and getting statistical numbers from the state regarding disease and condition. We're counting getting our program area detail info, all the things that you see in this report. We're kind of gathering it together. I'm not dropping it into the template of the annual report because there might be something that you guys might want to a different format change. You know what I'm saying? And I'd rather have that clear before I start because it's so much work to do it otherwise.
That's fine. I don't have a problem with that at all.
All right.
Can I add something? This is Mike Early. I do have a child in school, and I am notified when someone gets COVID in the school system. So maybe you guys don't because you don't have a child in the school, but if you have a child in the school, you are notified. You're not specifics, but I'm told what school.
Yeah.
I don't get a name, but I do know if it's hit the school system, which it has.
Oh, yeah.
Right now.
it has.
Monroe Elementary.
We've had some exposures in town, and the health department works very closely with the Board of Ed, and we have done manual calling to let people know, and it has been challenging. But again, all that obviously is private information. But if there's been an exposure, Joe Cosba, he will send out notifications to parents. So there's kind of two levels. There's a notification, and then there's the contact tracing, interviewing piece that's done by either the nurses and the health department. It depends on the type of exposure. So yeah, we are involved with that. Yeah. But okay, because I think that maybe something like that needs to be included. We just have to figure out how we want to put that under in the report. So okay, so that's that. And then the final thing is the budget, and we've sent you a number of documents. There's the fee schedule to start with, and I can just say, because of the climate that we're in, I don't suggest raising the fees at all. I don't know what anybody else's thoughts are on that.
I would not raise any fees.
No, I don't believe any fee should be raised either. You know, it's been a tough year for a lot of folks, so I don't think, and you know, obviously the restaurants are hit hard of no income and that sort of thing for many months. So were the, you know, salons and all that kind of jazz. So yeah, I would definitely not want to raise any kind of rates at this point.
Now,
I agree.
Now we're supposed to look at the fee schedule every year. Do you want to make a motion that we've agreed that we're not going to raise the fees this year, or actually next year?
I don't think we really need to do that, to be honest with you.
That's fine.
You know, we'll just the fee schedule is just going to stay the same. If we were going to change something, that would be a different story.
Right,
Then we would need the motion and vote.
Okay, we'll just put it in the minutes then.
Yep, that we all you know, agreed to keep it as.
Do we all agree?
Yes.
I agree. Yes, Mike agrees.
Yep. Okay.
Bruce Davis agrees.
Okay. All right. Then you have another sheet. I don't know who can see me, but I'm showing it to those that can. On the top, it says Monroe Health Department Budget Comparison Report. Barb sent this out later today, and she added a few things compared to the one that you've received. I think it was last week. And so in putting together the budget, and this was last year, we were trying to figure out now, how are we going to compare years? Are we going to like compare the last 2 years and then divide it by 2 and come up with a number for a proposed budget? You know, how are we going to do this? So if you look at the budget, item 1, Barb literally pulled off, you know, out of our database, the number of licensed facilities and how much fees that we will project to get based on those facilities this coming year. So those are solid numbers, and they're a little bit different, but as you see, the 21-22 is a little bit lower than the 2019-2020. Actually, it's lower than going back to 2016-2017. So, you know, but that's the best number that we have. The same thing with salon inspections. These are based on the number of salons that we have. But you see in that column, proposed 2020, 2021, 2022, we've left it blank because I'm not certain how you want to calculate expected funding under each item. So what are your thoughts? Am I clear? First of all?
So can you, I'm looking at the sheet now.
Yeah.
And I see your line 23. Is that what you're talking about? Cosmetology and tattoo?
Hold on a second. Which line are you on?
23?
No, there is no 23. On the top of this document, it says
Hold on.
Monroe, it's a legal size document. It says Monroe Health Department Budget Comparison Report.
Yep, I'm looking at that.
Proposed.
Proposed?
Yep, 2021, 2022.
Okay, all right. I apologize. That is the line that I'm actually looking at would be between 14 and 15.
That's correct.
Yeah,
So-
because when I'm in the Excel spreadsheet, because I can't print legal size,
Oh, okay.
every little line, regardless if it's just like the heading is counted as a line, a space is counted as a line. So that's why I said line 23. I apologize.
So if you look under salon licenses, we expect to get $6,685, and that's based on the number of facilities.
Okay.
But if you were to look up at permits to construct, which is item 11, we kind of guess every year.
I would almost be in favor of not making that number very high, just based upon not, the complete uncertainty of it all. Now, we're obviously all hoping that, by the time this fiscal year starts that we're putting our budget together for, which is obviously not until July of 2021,
Right.
that, this COVID will start to be, in our rearview mirror. Obviously won't be gone. We'll still be dealing with things. But, certainly hoping that we don't have to be quite as crazy as we are right now with it.
Sure.
But with that being said, I would certainly rather be a little bit more cautious in the numbers that we're putting up as a proposed budget. And obviously, if we end up with a little bit more because things did get better quicker than originally anticipated, then I think we're just in good shape.
Right.
Does anybody have any thoughts about what I just said?
I think we all hope that things will push ahead too. But yeah, I think I agree that the small businesses have been taxed to their limit. I don't mean taxed monetarily. I mean,
Correct. Yeah. Pushed
to their limit. And I think that if we can do whatever we can to support them by not pushing them harder, it's better.
Any thoughts, Chris?
No, I'm with you. I agree with that totally.
So, what I need to know is, like, for instance, on line 11, permit to construct, that's only 3 months worth of data right there.
Okay.
If I'm going to times 4 is about $11,400. I'm just kind of winging it, but about $11,400 for the year that we're in. And so that compares to like 2019, 2020, but it's higher than 18, 19, 17, 18, and so
Yeah, it's. I think we're gonna.
How do you want to calculate the proposed amount? Take the last.
So, can I ask a question? What about what we don't have here? I know we don't have an actual for 2021, but maybe it would help if we had the proposed for 2021 so that we could just know if maybe we should just keep it the same for the coming year as it was for the current year. We have the actuals for previous years. But for the year we're in, we have just the 3 months of actual, but we don't have the amount that was the proposed. We can all look back and our papers from before. I wasn't on the Board of Health at this time last year. But, you know, what was the proposed for now? And maybe it needs to just be the same proposed, and we'll know that it may come in lower because of some of the small businesses that unfortunately went under.
All right, let me.
Well, things that, you know, have to do with construction, you know, I think it's going to slow some.
Right.
You know, obviously our food services and that sort of thing, I think that may also scale back some. But using the number that we have currently, and multiplying it out by, you know, the actual licenses that we would get based on the current licensed facilities, I think is probably a safe way, at least at this point, to set up budgetary numbers for. As far as, you know, just running right down, you know, looking at all of the, like 1, 2, 3, 4, I think we need to scale that back, because God only knows if we'll even be able to have any kind of, you know, because our farmers market this year was obviously a little bit smaller than normal. Although it looked like we kind of did okay dollars wise for that.
Now, the actual, our proposed budget for the year, 2021, that's on your revenue report, just as an FYI. If you wanted to put the proposed budget, so you can see what those numbers look like.
Okay. Let me see.
Is that the budget revenue detail that you sent to us?
Yeah. And so we have proposed budget on there.
Oh, that doesn't help.
It's the one that has the 3 columns where the in July, August, and September numbers on there for revenue.
Oh, okay, yeah.
The hospital computers are fighting me on opening these.
We even budgeted lower for this year.
Yeah. But basically, the food service licensing, that's based on the restaurants that we had at the time.
Right.
Hello.
Hey, baby doll. How are you?
Good. How are you?
But the restaurants that we have at now, as of today, for 21-22 that Barb calculated on line 1, we would be, if things were the same as today, we would be getting $26,090. Where last year, when we figured out the budget time that we're in now, we figured 25,365. So somewhere along the line, we have more businesses.
Right. Well,
These things, you know.
I mean, it's not a lot different. You're only talking, you know, $700 or something like that.
Yeah, that's exactly right.
That's the equivalent to like 2 restaurants.
Mm-hmm.
So I would say we'll use the number of licensed facilities for that number that's current. That way, you know, we have a hard reason for using that particular number. Now,
so Chris, the one thing with that is the number of licensed facilities may not, and I'm just throwing this out there, we may have licensed facilities that are not that their license is still in place, but they're not operational.
Currently, but don't
Right.
forget, it does start, the budget we're talking about won't start until July of next year, and then goes all the way through, spring of 2022. So within that time frame, I'm assuming again, we're obviously all hoping that things will get somewhat better. So
Right.
my guess would be that you will certainly have some, unfortunately, some businesses won't be able to survive if, at 70% capacity that we're at now, or if we have to scale back, going back down to a 50% capacity, and God forbid we have to reclose them. Many won't be able to obviously survive that, but yet I believe others will come, hopefully later in the year, later in the fiscal year, to make up for at least some of those. Again, it's obviously a best guess of anybody at this point. With what we're trying to figure out, we're trying to use our crystal ball to figure out exactly what's going to happen in the future, and obviously there's just no way to do that. So
Right.
we just got to use our best guess with what's happened in the past, possibly taking into account some potential scale back of revenue based upon licensing and that sort of thing, but also hoping that some will take the place of others that have folded. So, I mean, if you have a better idea as to be able to say, well, how did you arrive at this number? I'm all ears.
Well, that's where, since the budget that is the proposal for the time period we're in right now was proposed this time last year, so pre-COVID, proposed for now, even though it's not what the actuals are now because of COVID, if we're proposing now for something that doesn't start until next summer, I would think that it could probably be pretty even to what was last year for now. That's why I was saying we probably can just keep the proposed numbers about the same. Because hopefully things will be back to that normal. But we'll see. If it's better to go low, just to go low so that we're not coming in low, I guess then we go low.
Enid, what
I'm here.
is there anything from a town council perspective that would you rather us budget a slightly lower? I mean, I know it's not totally up to you right at the moment or anything, but is there any suggestion that you would be able to give us at this point to say, we should scale back on our budget, our income, and obviously if it's better, it's great. Therefore, we're putting more money into the coffers for the town. Or is it better to, swing for the fences or whatever and hope for the best type thing?
The whole point is, we've been virtual for 9 months. That's like I've done 20 meetings literally virtually. The way I'm sitting and talking to you guys, of course, I pay lots of attention because I'm running the meeting. So I don't think, speaking for me, but probably for everybody, I don't think we would care which way you did it as long as Nancy comes and explains the budget if we have any questions. Or if Nancy goes to Ken, so then she doesn't have to be there, then she can explain, or he can explain what what you're thinking of. I don't think it would make a difference to us which way it was done, as long as Nancy can tell Ken in case one of us asks a question. Making myself. That's the main thing, because we're not going to say, oh, look, they have $15 extra in there. I mean, we don't look at it like that.
Right.
And we do read all the budgets. So as long as Nancy said to Ken, hey, the people on the health department decided to do blah. That's all we would have to know. So in case someone other than me asked a question, Ken could say, well, what they decided to do was blah.
Okay, understood.
Okay, all right. Like to listen to these meetings. I don't do much commenting, but I'm certainly sitting here, so, you know, whatever. Thank you, guys. I mean, but
And you'll
I haven't gotten my pay though, Nancy. I was supposed to get paid for this job.
Is the
Those
check
are
in
all
the
in my
mail?
account. Oh, the check is in the mail. Oh, thank you. All righty. Bye-bye. But I'm sitting here, so thank you.
So the comments that I had for 19 and 20, we left them in there so that you can see why we made those decisions or why I made those decisions, and we all kind of agreed to it. So on the comments column, it's on number 1, they're based on the licensed facilities. Food service re-inspections based on 3 failures. It says pre-month, but it's per month for remaining fiscal year. And it's going to be hard for those re-inspections because hold on one second. Somebody's knocking on my window. I apologize. What is going on?
Probably a taxpayer.
You're in the wetlands, right?
No, I'm the health department. I'm on a meeting on my phone. I'm sorry, I can't talk.
Where's inland wetlands? I'm supposed to go to a meeting. No one's giving me any
Oh,
information.
the door. Is the door? It's virtual. Is it
Yeah,
virtual?
but they didn't give me any. They didn't give me any link or any. I don't know what the hell is going on with these. Where am I supposed to go? No one's giving me any information. I'm sorry to interrupt.
No, just
You're the only person I've seen.
What's your name? Are you from
That's
the
because everybody else is on the phone. Oh my goodness.
What can we say? I think we should say hello to him.
No.
Hold on, I might have an answer. Inland wetlands. Hold on. I'm on the website.
And you're supposed to go to a meeting?
Yeah.
And what's your telephone number?
203.
Yeah.
258.
Yeah.
5707.
And the meeting was for?
Inland wetlands.
Yep, it says it.
All right.
I'm gonna go home.
203-258-5707.
Yeah.
Okay, because you should have gotten.
It's remote access. Can she hear me?
You should be able to.
On the website, it has the phone in.
Go on the website.
On the town website, it has the phone in with the access code.
Sorry, Mary?
On the town website,
On
it
website,
has the access code for the inland wetlands meeting.
it has the
That's at
access.
7 p.m.
Thank you.
Where though? I can't find that.
I can talk them through. If you go to monroect.org,
I did. No, I went.
Okay. Yep, he's got that.
town meeting schedule,
Town meeting schedule.
Yeah.
Yeah.
and then go to the calendar. When you click on the,
Oh, you have.
hold on. When you go under community events,
Yeah, but why didn't you?
under upcoming meeting, click on upcoming meeting and it gives you a calendar. And on the calendar, you can click on the date. And then the meeting's listed on there and it gives the link on there.
All right.
Sorry.
Sorry about, yeah, we're not, we're help.
I apologize.
No, not worry.
I just don't know what to do. I wish you.
It's new to all of us.
All right. All right.
Okay.
You have to get, that, is it a must do?
We should all hang up. See if Nancy gets the joke.
All right.
Yes, that's-
I don't either.
All right. I'm coming back to the meeting.
Thank you, Mary.
Oh, jeez. All right, we're back. Now, where are we? Sorry about
Okay.
that.
We were talking about something with revenue reports.
I'm sorry about that. He was knocking on the window. First of all, you can't see through the window. It's black. So who knows who's out there? So that's a whole nother thing. Okay. So let's see. So anyways, if you see on the comments for FY 2019-2020, that column, that was the decision-making process for that year. I can kind of use that as a guideline, and we'll plug in numbers, and during the next meeting, we can see if it makes sense. How's that?
Okay, that's not a bad thought. However, for the re-inspections, I don't think we should use 3. I think we need to go to 2.
I would suggest even going to 1.
Okay.
You know, so little things like that we can tweak as we go along. You know what I mean? For even temporary events, we're going to have to tweak that as well. Because the actuals is $2,920 for 2019-2020, and if you're looking at, you know, just for 3 months, it's 65. Is that right, Barb?
I'm sorry.
That's, yeah, I mean, it's 65, so it's times 4. That's not a lot of money. So those are the 2 areas what I would suggest we really need to sharpen the pencil a bit, because certainly that we're not getting the money in for those 2 categories. So there are other documents that we've included as part of the email, just to give you an overview of the line item, budget items, where we spend the money. I don't think we're going to be buying color toner anymore, because Ken wound up getting new color printers. So, and the cost of that toner will go, of course, be will be in another expense item, but not in ours. So we won't be able to add that to our line item expense. That goes into the town's somewhere else's expense. So I don't know. So any other thoughts? Did I lose everybody?
No, I'm here.
I'm here.
We're all still here.
It's hard to, this is a bad setup, I admit it.
You almost lost me though with the window knocking. I'm like,
Yeah, but Mary saved the day.
Oh my gosh. That's just because I have a computer open while I'm on the phone and whatever. Oh.
So unless anybody has any other thoughts, I think we can just move off that topic.
All right, so
Yeah.
Nancy, what I want you to do is start with on the one on line 2, the re-inspections. I want you to base it on 1.5 failures per month.
Okay.
For the money. The plan reviews, same as 18-19. Yeah, for 3, use exactly what you said, base it on 18-19 for now.
Okay.
The temporary licenses, and farmers market, I would base that on last year. I would not use 18-19 because that was a big year.
Okay. So use the 2,920.
Yeah.
Okay.
And I would use the 18-19 numbers for the wells and the septic.
Okay. And the soil testing?
Yes.
We'll probably get more money there because people are spending more in their homes.
That's true. But let's just ride it for what we got.
Okay.
And again, you know, if things get better, that's all great. We'll just have more money to deal with at that point.
All right. Do you feel the same way about the B100s and permits to construct the whole thing?
I'm just looking down the numbers right now. I would say yes, because the 18, 19 numbers tend to be a little bit lower for most of this stuff
Mhm.
than the 19, 20 numbers.
Yeah.
Obviously not all of them.
Lower? Well, yeah, not some of them are significantly more.
Well, the ones that are going to be the ones that we're using, we're not using those for the ones that are significantly more. And then the salons, based on the number of facilities, we can just go with that for the time being.
Okay.
Have all of our daycares reopened? I think they did. I'm thinking of the larger centers. I think all did reopen.
Yeah, I'm just trying to think the ones at the schools.
Oh, like you mean the ones that the YMCA runs?
Yeah. You know, I don't know. That question I don't know.
But that fee wouldn't be off by that much anyway. It would, right? I mean,
Well, they're going to keep their license.
right.
Even if they not happen to be, they're not open, they're still going to want to keep their license. So.
Okay.
And their
Yeah,
daycare license is due every 2 years. So it's a little tricky. They're paying just for an inspection from us.
I have to go, so I'll see you guys next month.
Enid, thank you very much for your help.
No big deal. Anytime. Thank you. Bye-bye.
Good night.
All right, so yeah, just the numbers we just spoke about, and then as you have written, just for 16, 19, 20. I guess we can throw like in 21, like $100 or something like that is fine. And then so fill that stuff in for us, okay?
Will do.
And then for the next meeting, we can kind of look at that a little bit.
Okay.
And if we, that way we have at least a little bit more of a hard number to actually look at.
Sure. Okay.
Rather than kind of guessing this and guessing that, because obviously we're tweaking this up and tweaking this down kind of things. So that way we can then all look at it, reflect a bit, and move forward with it. That way we can definitely have a vote for it by our December date, so Ken can have it for his January date.
All right.
Okay. That's pretty much it as far as that stuff goes. The revenue reports. The
other documents are just supporting documents, that's all. We really got the meat and potatoes there.
The only now I'm looking at the Department of Health actual the salary details and that sort of thing, where it has like the budget health with all the account numbers and stuff with it.
Yeah.
The only questions that the only question I would have on it is there anything in particular that you know of, training or conference wise, that you feel you and or Matt need to do for obviously this budgetary year that we're looking at?
Right. Well, what happened is I've been nagging Matt to spend that education, because my goal is for him to be an assistant health director.
Okay.
And so I want him to get management experience, and I'm giving him as many opportunities as I can, to be honest.
Okay.
Excellent employee. And so, but I want him to get formal education, but we're kind of caught between, there isn't anything being offered at the moment. And he's doing a lot of the environmental work, and there's been a lot of B100s and septic work. So he's just trying to keep the department afloat right now, because we're in this, because I can't help him in the environmental work right now. So it's a matter of time, and it's a matter of the class being offered. So, and that's in this year's budget. So hopefully I'll be able to get him to, we'll find something this year. So next year, it's hard to know, because I know that Ken has really concerns with the town's budget, and so I wouldn't advocate increasing that much. Let's put it that way.
Yeah, I wasn't going to advocate any kind of large amount. It was more of just, was there anything that you felt strongly about to get education, either for him or for yourself type thing, beyond, what do we have on here? The $740 that we went, that we upped a couple of $100 from the, year previous.
Not that I can think of at the moment. The one thing that I really would like, and I don't know if we'll be able to do it, and we had discussed this last year, is we need somebody like a consultant to help us develop our strategic plan. Either that, or I suggest a subcommittee of the board to help take on this task, because I won't be able to do it myself. We can do it, but I just need help doing it. So those are those two things.
This is Mary. I would be happy to serve on that subcommittee if that's the route to go. I think that when we had talked about the consultant, didn't you go to Ken about that, and the cost of a consultant was not approved?
Right. That's what happened there.
There we go.
Yeah, that's what happened there.
It's not going to get approved, that's for sure.
Yeah.
I don't think we need to look at the whole strategic plan and see it as like, oh my God, we have to do all of this. I think what would be helpful is if we took this one evening of a board meeting or a separate meeting and just looked at the strategic plan and make a decision as to, this looks good, let's stay on the same track. But on this part, we really need to do some sort of an assessment. And the assessment can be limited in scope, but it's at least put a plan together,
Correct.
It's that's the most important part, because that gives me direction on where to go in a normal year. The strategic plan that was established, I think it's 4 years ago now, was parts of it were we need to do outreach in the community. We had to let the community know that we existed. So that was one of the goals. And under the goals, how was the health director going to make this happen? Well, we were going to have outreach. It's a number of nonprofit organizations. We were going to set up like a table at different events, participate in the race for taste, whatever they call that, these different types of things that are happening in town, so that we can get our name out there. And so we've been doing these things. And so we need to establish maybe a few goals. It could be 2. And how are we going to get there to achieve those goals? We're a small department. We don't have a lot of bandwidth.
Yeah.
But we need focus like a laser, so that if we to achieve something, and if we want to get our name recognition out there, that was an important achievement. And so we did everything that we could to do that, establishing a Facebook page, all of those steps. So, and that went well. So maybe we need to revisit that. It seems to me that last time around, I invited a group of restaurateurs and septic people in town, and they were interviewed by not me, but the consultant. And they were asked questions like, how is it interfacing with the health department? What are the things that we could do better? And what happens is these specialized groups came up with some thoughts. And there's actually internal and external stakeholders, and those are the external stakeholders. There was also another group, which was like the building department or our internal stakeholders. And all this information was compiled and this report was created. We don't have to go that broad, but I think it's a bit of a challenge because I've never done one. And but I think we can do it. But I can't do it alone. That's the ticket.
All right. So, I mean, at this point, we're definitely not going to go anywhere with that anytime soon.
Right. Okay.
So, we can certainly, if you have any ideas, Mary, do you have a copy of that strategic plan?
Oh, the strategic.
It was
Probably. Yeah. I have printed everything and put it in a binder that I don't have here with me because I'm at the end of my work day and I called in, but I'm sure I have it at home.
All right. So if you can find it, great. If you can't, then obviously, Nancy.
I can get it resent, right?
Absolutely.
Resent, yep. And and the strategic plan, what I should be doing is reporting out to the board. And I've been doing this every year. It's just that we are late on this last year on what I have achieved in that plan so that you can see what is left hanging out there and what we've achieved. And that might be a good starting point because if you see a document that's really like, oh, they have all this to do. So what have you done? That's the most important part. So, yeah. So that's something maybe in the fairly near future that I can even get out to the board, Chris, so they know where we are, since it's been a while.
Okay. Does anybody have anything else they would like to add at this time? Mary, anything else?
I'm good.
Chris?
I'm good too. Thank you, guys.
All right. Michael?
No, I'm good.
All right. Then if nobody has anything else, with no further ado, I will motion to end our meeting this evening. I'd like to thank everybody for their time this evening. Mary, for coming on at the last possible second so you can actually get some say in here and get your ideas known. I think it was awesome. Thank you.
Good job, Nancy and Barb.
Hey, thank you.
Thank you.
Hats off to you guys there at Town Hall.
Yeah,
all right, everybody have a good evening. We're going to officially say it is 7:37, Nancy.
I got it.
And who seconded, by the way?
Oh, Mary.
Okay. All right, that's fine. And we all voted and we're all done. Thank you, everybody.
Thank you.
Have a good night, guys.
Bye-bye now.
Bye-bye.